My TED Talk is Post Traumatic Stress Disorder in Children in Haiti. What is trauma? Trauma is a wound to the body energy, either in a physical or psychological term. It defines an event that causes harm or energy to your cycle, such as trauma events, disaster, diseases, or accidents. Most trauma events are unpredictable. Their result scatters people's sense of safety and security, present in every episode that might be labeled trauma. Now, this is the definition from Kids Without Border. For trauma may be caused at any time, traumas or unpredictable. We may have instances where we experience violence in our household. We may witness abuse, physical or mental abuse. We may witness someone being killed. We may be a part of a sexual abuse or witness someone being sexually abused. When you have post traumatic stress disorder, it's hard for you to concentrate in school. It's hard for you to get a good night rest or hard to fall asleep. There's not many things that will hold your attention. You may also have sudden outbursts. You may become aggressive because children don't always understand their emotions nor how to actually express themselves. So therefore, they act out with violent behavior, disobedience, uh, not paying attention in school. They may fight others because they don't know how to express the emotions that they may be feeling. Post traumatic stress experiences causes you to walk in fear, always on edge, tensed up, especially when they're saying there's a hurricane coming, or if there's an experience with the earthquake or any accident, or if they have any kind of terrorist attacks that may occur. All these things will call it's considered a trauma and will cause you to have this post-traumatic stress disorder. According to the Department of Veterans Affairs, out of 100 people, at least 6 people may have experienced some type of trauma in their lives. The National City Center for Post-Traumatic Stress in the United States Department says believe that women experience more post-traumatic stress disorder than men. Now, there's various symptoms of stress disorder. Now, let's take a look at some other issues that percentages, whereas if it's physical assault, is 70%. Sexual trauma is 64%. Rape is 57%. The death of a loved one is 43%. Tragic accidents, 40%. Or just having a bad accident, an injury or illness, 34%. A weapon assault, where someone will assault you with a weapon, whether they pull a gun out on you or some type of weapon to harm you, and severe suffering and accidents. Natural disasters also on the list for having also a percentage of 14%. Now, all of these things or events that may occur that will cause you or may make you have post traumatic disorders. Now, let's look at the chart. Let's look at some of these symptoms that may relate to the PTSD. Flashbacks. You may have experienced flashbacks from the event. Some may have nightmares or haunting memories of the event, mood swings, memory problems, feeling detached. Because of the trauma, we may begin to isolate ourselves because we may be feeling guilty. If it's a sexual uh, assault, a sexual trauma, we may feel guilty. Emotionally numb sometimes we may feel sad and suspicious and irritated, and anxiety also will set in. We have trouble sleeping, we easily afraid, we don't like pain or trembling. We avoid issues in life. We avoid expressing ourselves and emotions. Now, other uh, symptoms could be fear. Like I said, you could feel shame and guilt. You have anxiety. And children, because they may not be able to express themselves, may start acting out in school. They may start wetting the bed. They may stop talking. Some kids, if they're young, because they can't express themselves, and they may stop talking or stop communicating, and they may feel isolated and withdrawn. And all of these symptoms are symptoms that has to deal with post traumatic stress disorder, which is a mental health issue. Some kids may begin to cling to their parents, especially in situations where there's violence in the home. Now, of course, this disorder rather, affect children in different ways. And different children respond in different manners. Research has said that if a child continues to have symptoms over a month or maybe 2 months, they consider that to be a mental disorder. And this disorder can affect children at any age. Now, this chart has different percentages of ways that trauma has affected children and the percentages of the ways that the children are exposed to trauma. Father Eddie is an ordained Catholic priest in Haiti. He's a director of mental health with PIS, Haiti's sister organization. He stated that mental illness in Haiti had largely increased, and because of the worsening situation that they're experiencing. He noticed with the earthquake that happened in 2010 that the post-traumatic stress disorder increased drastically. They had high level of depression, anxiety because of the disaster. People became unemployed. There were violence. There was political issues going on. All those things was affecting children at the time. According to research, studies showed in Haiti a significant amount of post traumatic stress disorder, ranging from 10% to 86% following the earthquake in 2010. With some children include youth from ages birth to 24 had the highest rate of 18 to 24 years old had the highest rate of post-traumatic disorder. Here is an example or a picture of the after the earthquake, the damage that was left and what the families had to start all over again and deal with. Out of the students that they had talked to, at least all had reported having a stressful event in their lives. 3/4 had reported being physically mistreated. 40% of the children said that they had experienced physical mistreatment. In addition to 58% reported that there was times when they felt that their lives was in danger. 57% had experienced the death of a loved one due to the earthquake. And because of the earthquake, a lot of the children was placed in foster care. Now, because in Haiti, they have limited resource for mental health to deal with the post-traumatic stress disorder. So they lean on support of others, support of the communities, their family. They work together as a community in order to resolve the issues of post-traumatic disorders. Because of the lack of resources, they all can't receive counseling. They resources that they do seek are religious, is based on their religious belief, the spiritual deliverance. They also do their art therapy with the children. They also do playtime, play therapy in order to help the children to deal with the stress. In this picture, this is a parent that's in Haiti. They're trying to get her to relate to the trauma that a child may be dealing with. So they had her cover her eyes and they explained the event to her so that she could kind of relate to what the children are going through or her children was going through. So this concludes my TED Talk about post-traumatic distress disorder in Haiti. Thank you for listening.